Then we are seeing about the behavior. So behavior means what? What type of behavior will be there? Sometime when you see about the mania patient and when you see about the depression patient, there is a difference is there. So when you are speaking during the history collection time, during the process recording time, when you are speaking, some patients are over friendly. They don't know you, even they act like they know you, okay. So their over friendliness will be there, okay. Too much extrovert will be, reaction will be there. Sometimes they are not friendly at all, sometimes it is normal. So that is the one of the important behavior you are assessing. Also you are assessing any type of stereotype behaviors are there, you are assessing. Then eye to eye contact, so very important. Most of the time psychiatric patient, they don't maintain the eye contact, that you have to observe whether they are maintaining or not maintain with all the difficulty, that is also you have to assess. Then you are also assessing the cooperative level, whether they are cooperative enough. As you are asking the question, they are answering okay type, but sometimes they will not be cooperative, they will be telling irritated, they will tell why you are disturbing me, like that they may shout at you. So they will not be cooperative to answer all your questions. So that is also you have to assess it. Then stuporous behavior are catatonic gestures or the postures. So postures, sometimes they will be having stiff postures or some abnormal postures are there, that you have to assess it. And stupor means not responding to the environment, that is called stuporous postures. They will be having, especially in the schizophrenia, sometime in mania also, that is also have to observe it. Then you also observe any other type of stereotype behaviors. Stereotype behaviors are like they will be having looking at one side, mannerism, gestures, all that you will be seeing. Then any obsessional work will be there, obsession or compulsion will be there. So what is that compulsion means? So all the time flapping of the hands like this they will be doing, or maybe they will be having throat clearing, or also they will be having if there is a sanitizer, all the time sanitizing. That is all the compulsion act. Also they will be having sometime nail biting, then shaking of the legs, that is also compulsion act. Then you have to check the psychomotor activity level. Activity, sometimes it will be high in mania, high in schizophrenia, low in the mood disorder, especially the depressive mood disorders, they will be having the low psychomotor activity. Also those who are having suicidal tendency and they will be having low psychomotor activity. Last one you will be assessing about the hallucinatory behavior. Any hallucinatory behaviors are present, any hearing of the voices, speaking, vision, all that is there, means you will be assessing. That is comes under the hallucinatory behavior. So this all comes under general appearance and behavior. Then we are going to speak about the speech. Speech, mood and thought we are assessing simultaneously along with the general appearance and behavior. Okay. So as we think, our thought, as we think or as our thought is there, our flow of speech will be there. So whatever is there in my mind, I speak, yes or no. So like that only, the same way we are assessing. Now first we are seeing about in the speech we are seeing about the initiation of speech, okay. Initiation means only when we are spoken, whether they are speaking or whether they are having minimal speech or they are spontaneously speaking. Now if you are asking a question about, tell me about your family, so much they will be telling. So spontaneously they speak so many things. So that is what initiation of speech. Then we are speaking the relevant of speech. Now what is relevance means? Whatever asked question, whether it is relevant, answers are given. Where are you from? So I came from here, there and all, they are giving unnecessary answer. It is means they are not relevant. Okay. Then we are also speaking about the productivity of the speech. Productivity means how much productive are their speech. So when we are speaking, when we ask any question, whether the speech is having elaborate expression or information, that is called productivity. Sometime we are asking how are you, miss, they will be answering only one word. Yes, I am fine. Okay, that is, we call it as monologue speech. Okay, only one word. Sometimes they don't speak they don't answer at all. It is called as mutism. Okay, so this is about the relevance. We are also checking the productivity and initiation. Then we are also checking, when they are speaking, we are checking the rate, rhythm, stream as well as the volume. Okay, what is this rate, rhythm, stream, volume? Okay, how good they are speaking. Is there any continuity of the speech? Okay, from one topic to another topic, is there any connection is there? Sometimes they jump from one topic to another topic. If they are jumping from one topic to another topic, we call it as flight of ideas. Due to the flight of thoughts, they are having flight of speech, that is called as flight of ideas. Then the continuity, sometimes they will be having thought block. So whatever they are speaking, immediately they will stop and they will think nothing has, I don't know what to speak next. So this is called as thought blocking or stoppage of the speaking. Okay, so thought block will be there. Then also we are seeing about the how much is the volume. Some people will be speaking so loudly, some people are not having any voice. Okay, very soft they are speaking. Then the this one pitch, they were as well as the tone of the speech, how good the tone is, speech is very screaming speaking or okay the tone, that also we are going to assess it. And we are going to assess any type of other type of speech are there. Is there any clang association? What do you mean by clang association? They are using the rhythmic words which has no meaning, together they are using it. Okay, like we are telling about tan and ran. Okay, so tan is different, ran is different, so they are using together. So clang association, there can be sometime there can be a verbigeration, mixing of the words will be there, that is also through the speech we will understand. Or there can be also word salad, mixing of the words, so many words will be there. Then incoherence, that means not coherent at all, from one speech to another speech there is no coherence, so that is all called as other type of speech. And also is there any echolalia? Echolalia means repetition of the words said by the others or said by the nurses or the doctors, that is called echolalia. Paralalia, saying same thing again and again, this comes under the speech. Then we are going to see about the mood. Okay, as we are seeing the speech, we are seeing the mood also, we are seeing the thought also. So what is the mood you are going to assess during the time of their speech or general appearance or their thought? So mood we are going to assess subjective mood and objective mood. What is subjective? How they are feeling. I say I am happy, that is my subjective feeling, but what you understand, whether I am happy or not, that it is your objective observation. So subjective feeling should be there and objective observation, that you are going to assess it. And you are assessing what is the predominant mood, all the time what mood is present to that patient. Sometimes all the time they are happy, only sometimes they are sad, or all the time they are sad, sometimes only they are normal, that is also predominant mood. Okay, then we are also assessing the whether it is appropriate. Okay, what they are expressing, that I am telling I am happy, if I am expressing happiness, that is appropriate, but if I am expressing sadness, then it is not appropriate. So whether it is the mood what we are expressing or we are telling, is it same? Okay, so that is called as appropriateness. Then we are going to see about the thought. Okay, as I said, mood, thought and speech and general appearance and behavior, everything is going hand in hand. I don't need to tell again and again. So thought, say what I am thinking, my speech will be there. So through the pattern of the speech, we are going to assess the thought. In the thought, we are assessing three parts are there. One is the we are having the this one form of thought. Okay, stream of thought, form of thought, content of thought. What is the stream of thought? The way that is flow is there. Okay, the flow of thought is there. Okay, that is we are going to say, is there any thought block is there, or whether the person is having any clang association. Circumstantiality means force of thought. Okay, if there is a pressure of speech is there, then there is a circumstantiality is there. Okay, and they are having the force. Okay, that we are going to assess in the stream of thought. Then we are also going to assess the form of thought. What type of thought? Sometimes whatever they are speaking, we can't able to understand. Okay, it is called as not able to understanding. Okay, this can be due to the circumstantiality. In word we are telling means too many things you are adding in that topic, but which has no meaning, which is no this one, what is that, relation at all, that is called as circumstantiality. Okay, you understood? Circumstantiality means so many things you add in that topic, but which has no meaning or which has no connection. Also flight of ideas, then clang association, already we have seen in the speech. Based on the speech only we are thinking, that is there in that thought. Okay, so this is all about the form of thought. Also you have to see, is there any word salad? Also you have to see, is there any verbigeration of thought? Okay, ecolalia to the through the, as they are speaking, we are mixing of the word. Word salad means mixing of the words. Verbigeration means mixing about the unnecessary words which has no meaning. Also neologism. Neologism means you are seeing if they, in the speech, if they are having, if they have a word coined new word, means invented new word which is no meaning at all. Okay, then we call it as neologism. So this can be because of their thought, the form of thought they are having, that is called as neologism. Then we are seeing about the content of thought. When we see the content of thought, there are 4 parts are there. In content of thought, we are seeing the delusion. Okay, what do you mean by delusion? Delusion is a strong belief or unshakable belief which cannot be modified. So delusions are different type of delusions are there. Delusional disorders only we are going to study it. Okay, there are in the delusion disorders are there. In the delusion of, some of the example may be delusion of persecution. Somebody is coming to harm me. Somebody is coming to kill me. Delusion of persecution. Then delusion of what is that? Delusion of infidelity. Fidelity means the husband is not faithful to me or the wife is not faithful to me. This type of beliefs are there. Then also they can be have delusion of grandeur. Very commonly most of the manic patient, most of the schizophrenia patient will be having delusion of grandeur. Grandeur means having think that they are supreme, think that they are having some supernatural power, and they want to do some extra activities, that is called a delusion of grandeur. These are the some common delusions we are going to see. Then we are seeing about the ideas. Ideas are like helplessness, especially the person who are suffering with the depression, they are having helplessness thought, helplessness idea, hopelessness idea, worthlessness idea. Also suicidal ideas will be there, that is also we have to read. Any compulsions are there, compulsions of thoughts will be there. So thought compulsions, thought compulsion means because of their thought, compulsive disorder, OCD people will be having some compulsive disorders, in that their thought compulsions are there, thinking all the time about sexuality, thinking all the time about hand washing, thinking all the time about keeping the things neatly. This is compulsion thought. So is there any compulsion thought also? You are going to assess in the content of thought. Then you are also assessing any other things, like in the content some abnormal thoughts patterns are there also you have to assess. So when you are want to assess the thought, mood and the speech, you need to have some pattern of speech which you have to be recorded. Okay, so this pattern of speech you are recording during your time of process recording. So as a therapeutic nurse patient relationship, as you are having the process recording, during the process recording you are doing the history collection, and during the history collection, during the process recording, you are assessing or you are collecting their pattern of speech. With the pattern of speech, you are able to assess their mood, you are able to assess their speech pattern, you are also able to assess their thought pattern. Okay, we will see now for the next, that is the 5th component of mental status examination. What is the 5th component? Perception. Okay, so as you know already, you are having, when they are speaking only, you will understand how they are perceiving the things, how they are perceiving the some environment, how they are perceiving the event. You will be able to understand. So in the perception, we are having the 4 type of perception. One is illusion, hallucination, deja vu and jamais vu, and also we have a depersonalization, derealization. What is this illusion? You all know that is having a false perception in the presence of external stimuli. Okay, in the present there is a stimuli is there or the external thing present, and they are having a false perception about that. Simple example is that rope will be considered as a snake. Okay, then we are having a hallucination. So hallucinatory behaviors are very common among the schizophrenia patient. Every type of schizophrenia patient, they will be having a hallucination, auditory hallucination, there can be a visual hallucination. There's a gustatory hallucination. Gustatory means feeling of taste. Then there can be also have a hallucination of tactile, touch. Okay, then the other type of hallucination, any other hallucinations are present means we will be assessing. Then we are also assessing about the deja vu and jamais vu. What is this deja vu? Deja vu means something is not happened any time, but they are experiencing, the patient is experiencing it has happened many times. For example, you are going and meeting the patient for the first time. and you are greeting them patient, hello, how are you are telling, but the patient is saying, oh, you have come yesterday also, very good, like that they are behaving means, that means they are having deja vu, that means they are experiencing that you have already come and you have already spoken to them, but for you it is a first time, for them it may be a many times it has happened, like that they are feeling, that is called deja vu. Whereas a jama vu is a something opposite, many times it's happening but they are experiencing for the first time. Okay, every day you may be going and giving the medication to the patient, but the patient will be telling, why you have come today only giving the medication, where is the another sister? So like that they are experiencing for the first time, that is called as jama vu. Then we are having the depersonalization and derealization. This is also sometime they will be having thought alienation time, they will be having the this one, what is that, depersonalization and derealization. What is this depersonalization and derealization means? So first, depersonalization, they think the environment which is present existing, it is not existing, it is something different environment. Okay, maybe they are thinking that they are in a some other very good environment, like in the heaven where everybody is happy, like that. Okay, the perception, or maybe derealization, they themselves think they are not real. Derealization means they are thinking that they are not real. Okay, something it is unreal things. So that is called as derealization, depersonalization and dereal. This is called as abnormal perception. Okay.